Okay, and we're back. Hello, Dr. Tagami, all the way from Tokyo, Japan. I'm so happy to have you here. We're honored to have you. How are you today?
I'm very fine, thank you.
Perfect. So we've already completed one webinar on April 10th with you, where we talked about caries and making it pain-free, and that was wonderful. On this webinar, the subject matters it's a little different. I could ask you, what are we going to be talking about on this webinar?
Yes, of course. The first webinar I mentioned about the importance of the minimally invasive approach of caries treatment. And at the same time, the very good sealing, perfect sealing is important to protect the pulp tissue and tooth of the patient. That's why the first webinar and the second webinar should be combined together and complete the very excellent minimally invasive caries treatment.
So this webinar coming up is going to be on April 24th, and it's
Yes.
going to be 5 p.m. New York Eastern Time. And if I were to ask you, what would I be learning if I were to come to this webinar? Because the first one was so great. What would you tell that dentist?
Okay. To achieve the perfect sealing of the cavity with adhesive resin materials, we need to apply the most reliable adhesive resin material. And then after that, we have to apply the appropriate procedure for the bonding procedures to obtain the maximum performance of the material. Also, in the cavity, one more very important issue we have to concern, that is the shrinkage stress of the composite. And because of the very strong shrinkage stress of the composite resin, many kind of unfavorable phenomena occurs in the cavity. So we have to understand it, and I can show you the solution of those problems.
So will you be showing some actual hands-on cases and case studies of the problem, how to understand it, and the solution?
Yes, of course. I will show you the procedure to prevent the gap formation and fracture of the tooth substances in the cavities, and also I, I will show you the procedure to apply the composite resin filling materials to prevent those kind of problems. Of course, that can be shown with my clinical cases.
One interesting question that I could ask you is, who should attend this webinar? Like if I was a dentist, if I was advanced in biomimetics or non-advanced, what do you think?
Yes, of course, I always talk about the fundamental to all the clinicians at first. And also, so year by year, we have new information from our research work. So recently, still, even now, we have new findings in our laboratory studies. So that's why I always try to improve our skills. So that's why the young dentists, young clinicians, and also the expert of the restorative treatment should learn something new, and some of the information must be very innovative. And for myself, it's very exciting to understand and to provide the solution of that problems.
Doctor, I'm going to ask you a question about bonding. It's often discussed. However, a lot of times the explanation is complicated. How are you going to make that more simple or more understandable?
I always try to explain the bonding, and also I could understand the bonding mechanism through our research activity in 40 years. So
right.
The conclusion is that the very sufficient penetration of the material into the tooth substance, and that penetrated bonding resin should be polymerized sufficiently. that is only two issues, but it's not so easy sometimes. So that's why we have to apply the appropriate application technique and drying technique and application of the light irradiation and also the application of the filling material to prevent the shrinkage stress. So that's why the bonding mechanism should be very simplified, simply explained. Uh, but the without this understanding, the appropriate clinical procedure cannot be applied. So that's why I always try to explain that bonding mechanism very simply. But um, sometimes some people may try to confuse the people because some of the material is not so much excellent. In that case, if I were the salesperson of that kind of poor material, I will try to confuse the clinician. So that's why there are too many information. They confuse
That's
us.
that's an interesting subject. Will you be covering some of that, of the materials that you've tested as well?
Yes.
Okay. Will you be covering how much dentin bond strength will be needed for clinical use as well?
It's not so easy to answer to this question. However, many people like to know that.
Yeah.
We try to answer to that question. In the past time, we try to evaluate the strength of the tooth itself. And enamel and dentin is very strong, mechanically strong substance. However, the weakest point of the tooth is the DEJ, enamel dentin junction. So we try to evaluate the fracture strength at the enamel dentin junction. And the specimen, the shape of that specimen was very similar to that of the bond strength test method. So we could apply the same shape of the specimen to compare the fracture strength. And the DEJ fracture strength was about 50 megapascal. And the recent adhesive resin material, the most reliable one is 80 megapascal. So
wow,
yeah, that's
so
why
you,
now
so
we
you do
can
know a number.
reconstruct the decayed tooth with the direct adhesive restoration. So that's why 50 megapascal is one of the critical bond strength.
Now, you and I were talking. I know there's something that excites you about, maybe you discovered something new that was unknown in the cavity by using something called an OCT observation. Could you discuss that a little bit just to kind of pique the interest?
For myself, I was so much excited to know that information because we didn't know that. That is, the fracture of DEJ in the cavity is often observed because of the shrinkage stress of the composite. And also, sometimes we apply the phosphoric acid to enamel as the additional enamel etching with phosphoric acid. In that case, unfortunately, sometimes we apply it to the enamel dentin junction. And the enamel dentin junction is very sensitive to the acidic attack. So that's why that um, region is very easily damaged. And because of the very strong shrinkage stress of the composite resin, the enamel dentin junction is separated. There is a fracture. Probably that kind of fracture may cause the sensitivity after the restoration. So that's why we should prevent that kind of fracture at DEJ as well as a gap formation. That is really new information for us.
So that sounds wonderful. What practical uses could a dentist use that information for?
Unfortunately, we cannot change the characteristic of the enamel dentin junction.
Yeah.
However, we should be very careful not to apply the strong acid etching material to the DEJ. That is the best solution at that moment. And next solution is to confirm the penetration of the adhesive resin material into that very, very small space at the DEJ and polymerize it very well. We can bond that separated part uh, and we can reinforce that DEJ if we can use the excellent adhesive resin materials.
Well, doctor, once again, I want to say thank you from all of us at the Academy of Biomimetic Dentistry. And for all of our dentists and viewers watching this video, to please join us. We would love to have you April 24th at 5 p.m. New York Eastern Time. Dr. Tagami will be giving us everything that he's got on these subjects and more, all the way from Tokyo, which is very cool. Doctor, thank you for joining us.
Thank you very much.